Assalamu alaikum and good afternoon from Malaysia. Thank you for joining this 30th webinar of MedEd webinar series. As you know, the topic for today's webinar is developing rubrics and marking schemes for assessment of medical students. The learning outcomes for today's session: the participants will be able to explain the purpose and need of rubrics and marking schemes, explain the differences between rubrics and marking schemes, discuss different types of rubrics and marking schemes, discuss different approaches for the development of rubrics and marking schemes, and finally, develop rubrics and marking schemes for different assessment methods. Let us start with answering this question. What is a rubric and why should we use it? A rubric is an assessment tool, often shaped like a matrix, and it describes levels of achievement in a specific area of performance, understanding, or behavior. It is important to know that rubric is specific for a particular task or assessment, and it can be used only for that purpose. It cannot be generalized. Typically designed as grid type structure, a grading rubric includes criteria, level of performance and their scores, and descriptors, which become unique assessment tool for any given assignment. Grading rubrics can be used to assess a range of activities in any subject area. Here is an example of a rubric for assessment of oral presentation. The criteria are given in rows, such as body language, eye contact, introduction, and closure. The levels of achievement are given in columns, here given number 4, 3, 2, and 1. And the descriptors are given in the cells. Here is another example of a simple rubric for assessment of history research paper. The criteria here include number of sources, historical accuracy, organization, and bibliography. The levels of achievement are labeled as excellent, good, and poor. For a criteria of number of scores, to achieve an excellent level, the student must use 10 to 12 sources. If student uses only 1 to 4 sources, he or she would be graded as poor. A rubric is an explicit set of criteria used for assessing a particular type of work or performance and provides more details than a single grade or a mark. Therefore, rubrics will help examiners grade more objectively as it provides more details in every particular specific area. Rubrics are one way to make learning expectations explicit for learners. These clear and explicit expectations help students see what learning looks like so that they can then absorb feedback in alignment with those learning goals. So by sharing rubrics with students, we clearly tell them what is expected of them in that particular assignment or assessment. Rubrics reduce grading time, increase objectivity and reduce subjectivity, help convey timely feedback to students, and improve students' ability to include required elements of an assessment as they know what is expected of them. Now the second question, why to use grading rubrics? There are a number of reasons and justifications. Rubrics create a common framework and language for assessment. Complex products or behaviors can be examined efficiently. Well-trained examiners apply the same criteria and standards, and therefore the inter-examiner variability is minimized. Rubrics are criterion referenced rather than norm referenced. The examiners ask, did the student meet the criteria for level 5 of the rubric, rather than how well did this student do compared to other students. Just to receive a specific level of achievement, student must meet that particular criteria. Using rubrics can lead to substantive conversation among faculty. When faculty members collaborate to develop a rubric, it promotes shared expectations and grading practices, again bringing faculty closer to an agreed level of achievement and their expectations. Students on rated reliability have demonstrated that well-constructed rubrics can lead to a common interpretation of student performance, again thus reducing the inter-examiner variability. The next question, what are components of a rubric? Rubrics are composed of 4 basic parts. In its simplest form, the rubric includes a task description, the outcome being assessed, for example, oral presentation skills, research paper, or an assignment, or a long case or a short case. The characteristic or criteria to be rated, these are given in the rows and are based on the skills, knowledge, and behavior to be demonstrated. Levels of mastery or levels of achievement. These are given in columns. The labels used to describe the levels of mastery should be tactful and clear. Some commonly used labels include advanced, high, intermediate, and novice. And then a description of each characteristic or criterion at each level of mastery, and these are given in the cells and labeled as descriptors. Here is an example. The criteria are given in rows. The levels of achievement are given in the columns, and the descriptors are given in the cells. Let us talk about each of these components. Criteria identify the components, traits, features, attributes, or dimensions which are to be measured or assessed and provide their description. Each assignment or performance will determine its own unique number of criteria to be scored. Criteria are derived from assignments, checklists, grading sheets, or after discussion with colleagues. Examples of criteria components for a term paper rubric may include introduction, hypothesis, arguments or analysis, grammar and punctuation, spelling, citations, conclusion, references. Next, level of performance. These are given in the columns. Levels of performance are often labeled as adjectives, which describe the performance level. Determine the degree of performance which has been met and will provide for consistent and objective assessment and better feedback to students. Levels of performance tell students what they are expected to do. Level of performance can be used without descriptors, but descriptors help in achieving objectivity. Examples to describe level of performance include excellent, good, fair, poor, or master, apprentice, or beginner, or exemplary, accomplished, developing, beginning, undeveloped, above average, average, below average, or simply complete and incomplete. Descriptors which are given in the cells of a rubric are explicit descriptions of the performance level and show how the score is derived and what is expected of the students. Descriptors spell out each level of performance for each criterion and describe what performance at a particular level looks like or is expected. Descriptors describe how well students' work is distinguished from the work of their peers and will help to distinguish between each student's work. Descriptors should be detailed enough to differentiate between the different levels and increase the objectivity of the rater. Scores make up the system of numbers or values used to rate each criterion and often are combined with level of performance. Each level of performance, which is usually given in the form of an adjective, needs to be represented by a number, a range of numbers, otherwise the scoring would be difficult. Begin by asking how many points are needed to adequately describe the range of performance you expect to see in students' work. Consider the range of possible performance levels, for example, clear fail, less than 45%, borderline fail, 46 to 49%, pass, 50 to 60%, good pass, 61 to 80%, distinction, more than 80%. Now let us talk about the types of rubrics. There are several types of rubrics, including holistic, analytical, generic or general, and task-specific. The holistic rubrics are good for evaluating overall performance of a task. All criteria are assessed as a single score or one-dimensional. Because only one score is given, the holistic rubrics tend to be easier to score. However, holistic rubrics do not provide detailed information on student performance for each criterion. The level of performance are treated as a whole. Performance descriptors are written in paragraphs and usually in full sentences. They are used for simple tasks and performances such as reading fluency or quick response to a question, getting a quick snapshot of overall quality or achievement, for judging a best dressed person, judging the effect of a product or performance. Here is an example of a holistic rubric where the scores are given in the rows and the criteria are given in the columns, and all the criteria are given in one paragraph and only one score is given for that. The second type, analytical type, each criterion is assessed separately using different descriptive ratings. Each criterion receives a separate score. Analytic rubrics take more time to score but provide more detailed feedback. Judging complex performances involving several significant criteria, providing more specific information for feedback to students. Analytic rubrics are two-dimensional with levels of achievement as columns and assessment criteria as rows. Analytic rubrics allow to assess participants' achievements based on multiple criteria using a single rubric. Analytic rubrics can assign different weights or values to different criteria and include an overall achievement by totaling the criteria. Analytic rubrics are written in a table form. Here is an example of an analytic rubric for a research paper where criteria are based, for example, on knowledge and critical and creative thinking. The levels of achievement are given in the columns, and the rubric and the descriptors are given in the cells. Here is another example of analytic rubric, which is group participation rubrics. Usually it is difficult to assess an individual student's performance in a group, but rubrics for this purpose can help to assess individual students in a group work. And the criteria here, for example, workload, getting organized, participation in discussions, meeting deadlines, showing up for meetings, providing feedback, receiving feedback. And the levels of performance are given in the columns. The third type, which is generic or general type, a generic rubric contains criteria that are general across tasks and can be used for similar tasks or performance. For example, long case examination. The criteria are assessed separately as in an analytical rubric. Generic rubrics are best used when all the students are not doing exactly the same task. For example, community work. Students have a choice as to what evidence will be chosen to show competence on a particular skill or product. For example, oral presentation or poster presentation. Instructors are trying to judge consistently in different course sections. The task-specific rubrics assess a specific task, for example, performing lumbar puncture. Unique criteria are assessed separately. However, it may not be possible to account for each and every criterion involved in a particular task, which could overlook a student's unique solution. It is easier and faster to get consistent scoring by using task-specific rubrics. It is used in large-scale and high-stakes contexts, such as state-level accountability assessments. It is used especially to know whether students know particular facts, equations, methods, or procedures. Now, let's look at the developing a grading rubric. There are 7 steps. First, select a performance or assignment that needs to be assessed. Begin with a performance or assignment which may be difficult to grade and where you want to reduce subjectivity. Answer following questions before beginning to develop the criteria for rubric. Number 1, is the performance assignment an authentic task related to learning goals and our objectives? Are students replicating meaningful tasks found in the real world? Are you encouraging students to solve a problem by applying knowledge? The answer should be yes to all these questions. Then list the criteria and begin by brainstorming a list of all criteria, traits, or dimensions associated with the task. Reduce the list by chunking similar criteria and eliminating others until you produce a range of appropriate criteria. In the first step, you may list down all the criteria which come to your mind, but then you combine them and group the similar criteria so that the number is in the range of appropriate criteria. A rubric designed for formative and diagnostic assessments might have more criteria than those rubrics rating summative performances. Keep the list of criteria manageable and reasonable. Then describe the criteria. Keep criteria descriptions brief, understandable, and in a logical order for students to follow as they work on these tasks. This is the example which has been given earlier as well, and you can see the descriptions are very, very clear, logical, and specific. Then determine the level of performance. Select words or phrases that will explain what performance looks like at each level, making sure they are discrete enough to show real differences. Levels of performance should match the related criteria. For example, distinction, good pass, pass, borderline fail, and clear fail. Then develop scores for each level of achievement. The scores will determine the range of performance in numerical value. Make sure the values make sense in terms of total points possible. What is the difference between getting 10 points versus 20 points? The best and worst performance scores are placed at the ends of the continuum, and the other scores are placed appropriately in between. It is suggested to start with fewer levels and then to distinguish between work that does not meet the criteria and then adjust accordingly. It is difficult to make fine distinctions using qualitative levels such as never, sometimes, usually, or limited, acceptance, or poor, fair, good, very good, and excellent. How will you make the distinctions? The answer is by giving scores. So define or identify the adjectives with numerical values. Then write the descriptors. As a student is judged to move up the performance continuum, previous level descriptors or descriptions are considered achieved in subsequent description levels. Therefore, it is not necessary to include beginning level description in the next box where new skills are introduced. The description in a particular cell is in advance or on top of the description given in the previous cell. Here is an example of writing description. For example, the task is palpation of abdomen. So criteria includes communication skills, preparation for examinations, technique and components of examination. You can also include findings and other criteria. The levels of achievement include distinction, good pass, pass, borderline, and clear fail, and respective scores are given. So to achieve distinction in communication skills, the student must explain to the patient about the examination and ask for pain, tenderness anywhere in the abdomen. And if student fails to explain to the patient or does not ask for pain, tenderness anywhere in the abdomen, that student would be in the column of clearly failed. For preparation of examination, the proper exposure, student must be conscious of modesty of the patient and should warm up hands. But if students are not conscious of the modesty of the patient, or they are performing under or over exposure, or do not warm up their hands, they would be in the category of clear fail. Then evaluate the rubric. Evaluate the rubric each time it is used to ensure it matches instructional goals and objectives. Be sure students understand each criterion and how they can use the rubric to their advantage. Consider providing more details about each of the rubrics area to further clarify these sections to students. Pilot test new rubrics if possible. Review the rubric with a colleague and solicit students' feedback for further refinement. Does the rubric match the model answer? Does the rubric appropriately reward application of knowledge over knowledge recall? Here are some tips for developing rubrics. Find and adapt an existing rubric. It is rare to build a rubric that is exactly right for your situation, but you can adapt an already existing rubric that has worked well for others and save a great deal of time. Evaluate the rubric by asking yourself, does the rubric relate to the outcomes being assessed? Does the rubric address something important? Is the rubric useful, feasible, manageable, and practical? Collect samples of students' work that exemplify each point on the scale or level. A rubric will not be meaningful to students or colleagues until the examples are available. Rubric should be written when the question is written and expect to revise based on the feedback. The point value or score for each criterion should be established to categorize responses as no credit, partial credit, and full credit. A smaller number of level options on the rubric limit the chance that a response falls in the zone of uncertainty and inconsistency. Prior to grading, faculty should establish guidelines on how to apply the rubrics to generate a score. In summary, rubrics serve multiple purposes for both students and educators in the learning and assessment process. Rubrics are effective and efficient tools which allow for objective and consistent assessment of a range of performances, assignments, and activities. Rubrics can help clarify the expectations and will show students how to meet them, making students accountable for their performance in an easy-to-follow format. The feedback that students receive through a grading rubric can help them improve their performance on revised or subsequent work. Rubrics can help to rationalize grades when students ask questions about method of assessment. Rubrics also allow for consistency in grading, especially when multiple examiners are assessing the same task. Rubrics serve as good documentation for accreditation purposes. There are some challenges in implementation of rubrics. Rubrics may be very time-consuming to create. Rubrics may not fully convey all information instructor wants students to know. Rubrics may limit imagination if students feel compelled to complete the assignment strictly as outlined in the rubric. Rubrics may lead to anxiety if they include too many criteria. One big downside to task-specific rubrics is that often they can't be shared with the students because they give too much away about the task itself. So in this sense, they are missing the most powerful aspect of rubrics, that is their ability to help students monitor their learning and progress. Regarding analytic rubrics, unless each point for each criterion is well defined, raters may not arrive at the same score. Now let us look at the other part of today's session, which is the marking schemes. The question, what is the difference in rubrics and marking schemes? In its simplest form, a marking scheme provides broad outlines for success and allocates a range of marks for each component, whereas a simple rubrics provides specific outlines and examples of what is expected for success and allocates specific marks. In other words, the marking schemes are more broad, whereas these rubrics are more specific. Therefore, rubrics can help the assessment in the form of objectivity, whereas the marking schemes may have more of subjectivity and less objectivity. Rubric is unique for a given assignment. Marking schemes can be generic. For example, marking scheme for long case examination. So a generic marking scheme for long case examination can be applied to different cases. Here is an example of a rubric for long case assessment. The criteria are given in the rows here: history taking, physical examination, provisional diagnosis, etc. The levels of achievement are given in the columns: excellent pass, good pass, borderline fail, and clear fail. And the descriptors give the details of each level of performance as well as the criteria. Whereas the marking scheme is limited in the sense that there are no more details. There are no specific information given for each level of performance, for example, in this case. Although some information is given about the criteria, but no information is given about the levels of performance. How to design marking schemes? There are 8 steps. The first step is write a model answer for each question. As and when you write a question, write the answer immediately. It is a useful first step towards identifying the mark-bearing ingredients of a good answer. The mark-bearing ingredients. It helps to estimate the time required by students for writing the answer. If you have difficulties answering the question, the chances are that your students will also find the same difficulty. For example, you are asking 5 number of causes and you find it difficult yourself to find the 5 number of causes. Of course, the students will not be able to answer that. Number 2, make each decision as straightforward as possible. Try to allocate each mark so that it is associated with something that is either present or absent, or right or wrong in students' answers. Aim to make your marking scheme usable by a non-expert in the subject. This can help your marking schemes be useful resources for students themselves, perhaps in the next year's program. Aim to make it such that markers are likely to agree on the scores within mark or two. It is best to involve colleagues in your piloting of first draft marking schemes. Your colleagues will help you to identify areas where the marking criteria may need clarifying or tightening up. Allow for consequential marks. For example, when the candidate makes an early mistake but then proceeds correctly thereafter, allow for some marks to be given for the ensuing correct steps, even when the final answer is quite wrong. Pilot your marking scheme by showing it to others. If they can't see exactly what you are looking for, it may be that the scheme is not yet sufficiently self-explanatory. Adding extra details at this stage may help you to clarify your own thinking and will certainly assist fellow markers. Look at what others have done in the past. If it's your first time writing a marking scheme, looking at other people's ways of doing them will help you to focus your efforts. Learn from your own mistakes. No marking scheme is perfect. When you start applying it to a pile of scripts, you will soon start adjusting it. Keep a note of any difficulties you experience in adhering to your scheme, and take account of these next time you have to make one. There are a number of benefits of marking schemes. They promote fairness and consistency in marking assessment, develop shared understanding around assessment of formative and summative work related to, for example, an assignment or exam answers. They help judge the quality of conversational work, like an argument in an essay or an open-ended text response to an exam question. Promote shared understanding of expectations between teams of markers, which in turn can lead to greater consistency and fairness in marking across student cohorts and locations and over time. They promote respect, understanding, and trust among academic staff. They make expectations explicit. Whether marking exam answers or students' assignments, the time spent making a good marking scheme can save hours when it comes to marking a pile of scripts. It can also help to know and show that you are doing everything possible to be uniformly fair to all students. As you may be required to show your model answers to people including external examiners and quality reviewers, it's important to design schemes in the first place so that they will stand up to such scrutiny. Marking schemes help to facilitate teachers, examiners, markers to avoid cultural and ideological biases of individuals, to allow students giving response to questions that may vary in length and depth, to provide proper appreciation to the answer given in response to the question asked, to permit students critical thinking on the statement given in the question, and to delineate the boundaries of the response. To promote cognitive skills such as awareness, perception, reasoning, judgment, and to eliminate impression marking. Some tips on developing and using marking schemes. Person who writes the assessment should develop the marking key or scheme or a rubric. Ensure sufficient thought has gone into the production of the instrument to ensure their quality, clarity, and usefulness. Discuss the marking scheme amongst the teaching team. Provide marking guides to markers in plenty of time so that they can understand it thoroughly. If policy dictates that marking guides should be used, then stick to this policy. If policy does not stipulate their use, realize that there are good reasons for using them anyway. So even if the institution does not insist on developing the marking schemes, developing them and using them is a good practice. Here is an example of a marking scheme for a short case. And here are the criteria and the examination components: approach to the patient, physical examination, findings, and then the differential diagnosis, final diagnosis, investigation and treatment, and the range of marks. Here is another example of a marking scheme of a OSCE, a physical examination of a patient with thalassemia. And again, the introduction, the physical examination technique, summary of relevant findings and interpretation of findings, and then the marks under 3 categories: satisfactory, less satisfactory, and not satisfactory or not performed. With that, I thank you for your attention, and I will be happy to answer if you have any questions. Thank you.
Thank you very much.
Thank you for your attention, and I'm really sorry for the confusion. Actually, my team was not here, so and you see, I was thinking the stages of life. At one stage, we would say, "I'm okay, my father is here," and now I was saying that I'm okay, my son is here. So really, life really teaches us a lot of things. Yeah, questions, please. Yeah, Professor Aslam.
Thank you very much, Professor Alamkir. As usual, it was a good process of learning. My question would be, that is, don't you think that too much of analysis or too much of the rubrics curb or mitigate the philosophy of higher learning? It makes us more technicians and mechanical rather than going for philosophy of higher learning. And this process probably cannot be applied to the fullest extent in evaluation of thesis or dissertation for the higher degrees. What do you think?
Right. I fully agree to your initial comments. That's absolutely right. But look at the situation where multiple examiners, for example, it's our final year examination, and it's a long case, and there are 4 or 5 teams, and they are examining. Now, if there is no common understanding, if there is no common standard, each examiner would be marking at their own judgment. Of course, examiner judgment is very important, but a standardization has its own benefits. So in that case, some students may benefit, whereas others may lose because the inter-examiner variability. So that's one. But when it comes to, let's say, if there is only one examiner, or there are 2 examiners and they are coming to a mark with consensus, for example, in case of thesis, then there is no problem. The main purpose of these rubrics and the marking schemes is the fairness or equal chance to every student. And some, as you felt that it becomes like more mechanic. The the best thing is that we give, rather than giving a fixed mark, we give a range of marks.
Yeah.
And when you give a range of marks, you give some power to the examiner to work within those marking scheme and where the examiner experience would come in. So that's the answer to your question. I hope it answers that.
All right. Thank you very much. Thank you indeed.
Right. Dr. Kumari.
Yeah. Good
Yes,
afternoon,
Good
sir, and thank you very much for this wonderful opportunity to have this webinar with us. Sir, my one question is that what type of example can be with rubric which cannot be shared with the students? I could not get it exactly.
Yeah, it is actually the task specific,
Okay.
where the rubric is very, very specific to a task and giving the details. That would be, in a way, giving too much information to the student. So only limitation is the task specific. Otherwise, other rubrics can be shared. But if you feel that the task specific rubric does not give too much information to the student, then that should be shared as well, because sharing with students is a big benefit or big usage of rubrics.
Yes, sir. Sir, it will be nice to give the rubrics to the students after they have been assessed, so that they are free to answer. They are working with their brains and thought process freely while giving answer. They are not working with the rubrics. And when the assessment is over and they are getting it, then they could analyze that where they could not think of. Will it be better, sir?
No, it's in both ways. You see, it is only fair that the students know that what they are expected to do.
Yes, sir.
And how they are being marked. So I think it would not be right to mark students without telling them that what is the criteria and how they are being marked. So that's the advantage of sharing it before the exams, for example, or before the assignment. When we give an assignment, we give a rubric for assessment as well, so that they can prepare the assignment according to the rubric. The use after that is again very, very important, because that would be the feedback, and in a way, students can assess their own assignment based on the rubrics, and then they can come and discuss with the examiner. So it is useful both before and after the examination or assignment.
Okay, sir. And one more question, sir.
Sure.
For piloting any rubric,
Right.
what should be the minimum participants required who will be peer reviewing that rubric?
Yeah, I can't give the exact number of people involved in that, but if, let's say, it's your colleagues or some senior students who have gone through that process, their feedback would be useful.
Okay. Okay.
Okay. Shahzad Ahmed Saab.
Thank you, sir.
Shahzad Ahmed.
Hello, sir.
Yes, sir.
Yes, I have a question. First of all, thank you for wonderful presentation. Regarding the validity of rubric,
Right.
sir, if we adopt according to our situation, as you mentioned, that
Right.
we can adopt according to our specific situation, and no rubric is, perfect. So
Right.
what is the validity? So there is a question about validity, and number
Right.
one, and
Right.
number two, you have allotted different marks for different level. For example, you gave excellent to 80% or above, and you declared fail for 50% or below 50%. So what is the criteria that, for example, can we say below 60% fail, below 50% fail, below 40% fail? So what is the criteria for these marks to declare fail, good,
Right.
excellent?
Right. So I'll answer the second part first. Actually those are the examples, but you need to follow the institution's policy. If your institution policy is fail below 60%, then of course you have to follow that. So let's say what score would be distinction, what would be the good pass, or what would be the fail. You have to follow the institutional policy. Regarding the validity, I think if you have some colleagues and who have gone through that, and you have drawn a agreed criteria among your colleagues, the senior examiners, I think that gives the validity to that marking scheme. Now, as I said, it's not perfect. I'm sure many of us has this experience. When I have a marking scheme and I start marking question papers, let's say pile of papers, and suddenly I feel that there are some areas which this marking scheme does not cover very well, and I need to improve on that. And it is over time that the marking schemes and rubrics will be improved. There are always some situations which we had failed to consider, or we couldn't think of those situations, and when we are marking the papers, those situations become apparent. So the continuous process of improvement, I think that would always be there.
Okay, thank you very much.
Yeah, Hamid Bhatt.
Thank you very much, Professor Alam Sher Malik. It was
Thank
a
you,
very
sir.
nice lecture.
Thank you, sir.
My bit of feedback on your talk would be that rubrics are an excellent tool in the paradigm of formative assessment.
Right.
And currently the ophthalmology specialty has developed by the International Council of Ophthalmology a toolkit of Oscar rubrics, which is ophthalmology surgical competency assessment rubric.
Okay.
And we are trying to incorporate that in the College of Physicians Surgeons training program in Pakistan.
That's great.
For 3 bands of formative assessment.
Right.
Number 1 being the clinical skills, and they are being assessed by OCEX, which is the ophthalmology clinical examination exercise. So it's the version of mini CX specifically for ophthalmology.
Okay.
And for surgery, and then for ophthalmology surgical competency, we have OSCARS, ophthalmology surgical competency assessment rubric.
Right.
Now, as you very rightly pointed out, the task specific indices, and then global indices.
Right.
They break up the task into its component criteria.
Right.
And then according the level of scores is actually coupled in the columns with the Dreyfus and Dreyfus scale of competence.
Right.
And the scores which are generated are actually scoring the achievement of competency in all the criteria by the trainee.
Right.
So at the end, there is also a feedback narrative open-ended column,
Right.
So therefore, it is a combination of qualitative and quantitative
Quantitative. Right.
formative tool of assessment.
Right.
So I think your
Sir,
rubrics.
my question would be, if you find it so useful in formative assessment, why you think it's not useful in summative assessment?
Well, it is because the number of tasks which are to be certified for at the end of the training program are so many that it's literally impossible to devise a rubric for each of those areas of achievement of competency.
So basically, it's a logistical problem.
Absolutely. And then, but at the back end, the supervisor is actually certifying the achievement of those competencies on a listed manner, but a sampling of, like the summative assessment at the end is also a sampling, the long cases, the short cases, the MCQs.
Right.
So I strongly feel that the analytic rubrics are a very good tool to spread the shade of summative assessment in the 4-year training program, and that gives a lot of critical thinking skills and feedback opportunities.
If, for example, you are using OSCE, and it's the same examiner or same set of examiner,
yes,
then there shouldn't be a problem because there wouldn't be any inter-examiner variability.
Right.
But if in summative assessment, but if there are multiple teams examining the students, so then there has to be some understanding among the teams about the marking scheme. Otherwise, there would be too much variability between the examiners.
I totally agree with that.
Yeah.
But
so
the point is,
that's why I'm not sure how to handle the logistic reason you are mentioning, but I find that the usefulness of rubrics, even in summative assessment, is really something which we should explore.
I totally agree, but I think the analytical rubrics or the tool belongs more to the formative domain rather than, so it can be shared within the formative and summative, but I think currently the formative bit in the training programs is blank. There are no tools which are used in the 4, 3, or 4-year training programs. And these are, if they are used judiciously. And then also another thing which I can suggest is that it is not necessary that all the tasks are completed in one specific rubric. For example, cataract surgery.
That's right.
In the first year, you can actually stagger them. And the rubric can be filled in the first year, some components in the second year, and some in the third year.
That's the vertical integration. Yes.
Thank you.
Right. Thank you very much, sir. Dr. Maha. Dr. Maha, please.
Yes.
Yes, please.
Yeah, thank you, Dr. Alam, for the very informative lecture. I would like to ask some questions mainly about the OSCE.
Right.
So I'm talking about the OSCE rubrics, about using it in the summative OSCE.
Right.
So when it's a 5-point scale, if we use a mark scheme with marks only, there is no description, this will be a little bit subjective.
Right.
But if we give full description of each scale, so for example, if the student has to introduce himself, he has first to introduce saying his name, his role, and so we have to describe each single step the student should do.
Right.
This will be very clear, but it also will increase the load on the examiner. It will increase the examiner's load.
Right.
And it will also increase the length of the checklist.
Right.
So my question, should we keep it, should we describe everything for the examiner and make it completely objective, and where the examiner has no area or no space to give any point of view according to his expertise, but the checklist will be very long?
Yeah. Dr. Maha, if we do that, then examiners would be simply just anybody can be there.
Yes, exactly. Yeah.
So
This is my
and
question.
so and then this means that we are not giving due respect to the experience of the examiner.
Yes.
So I think we should respect the examiner's experience and give some leeway for examiners there. So it is a kind of guided marking, but at the same time, the examiner's experience is useful. So giving everything there and making it sort of so objective, we would, I think, lose the lot of benefit which we can get from the experience of the examiners.
Yes, okay, Dr. Alam, thank you for your answer. But we are doing that actually.
Right.
But now we have like some comments on about our rubrics that there is an area of subjectivity and it should be completely objective. So when we and to be fair with
Dr. Maha,
students,
we would never be able to get rid of some subjectivity. And
okay.
if there are multiple examiners, they can actually cover for that subjectivity. We cannot do everything like mechanical.
Okay.
All right. Thank you.
Thank you, Dr. Alam.
Thank you. Dr. Imtinan Sharif.
Yes, sir. Thank you very much for such a wonderful presentation. I had a small question regarding the validity that someone mentioned. I think it was Dr. Fahad or Dr. Shehzad. So recently, I'm basically assistant professor of 4th year public health community medicine subject.
Right.
So we had a professional exam. Our university provides us with a TOS. OSPI, there is no issue about it because we have a very good rubric regarding that.
Right.
But there is an issue which we introduced this time. We have 2 examiners for 100 students, an external and an internal examiner.
Right.
And each of them have been assigned 30 marks, which is a huge marks, right?
Right.
They're supposed to ask questions regarding public health, regarding communicable diseases and whatnot. And they're supposed to grade the students. So what we did this time, but only our department did it. What we did was that we divided the 30 marks into more or less like 10 visible stations for the examiner. And like the first station would carry 3 marks with 3 questions from epidemiology. The second would. So what my question over here is, only our department did it, and do we need to validate, because we created this our own just for the Viva portion of the exam, because we still have that. There are other things as well, like research projects and whatnot. They have excellent rubrics.
Right.
But the Viva section, it carries 60 marks, 30 for the external. And so my question here is, do we need to validate this in some way, or do we need to first make sure, because the university just gives us scores and they tells us, can you guide us?
I think if the external examiner and internal examiners, if they sit down and discuss and they agree on that, I think we should believe in their wisdom, and that should be valid enough if the experts in the field, they have agreed to that marking distribution.
So we don't need to then validate it, right?
No, that's the validation is that if all the experts who are involved in the examination, if they have agreed to that scheme, I think that is the validity.
Okay, excellent.
Right.
We did inform the students beforehand that there will be 10 questions, 10 stations more or less in this 30-mark scheme with each examiner, so that they were informed about it. They had to read the whole book.
All right. I think that's fair. That's
Yeah,
fair.
thank you so much, sir.
Okay.
Thank you.
Dr. Laikuzaman, please.
Assalamu alaikum, sir.
Walaikum assalam.
All, I must comment, this was one of the finest that I've had from you, mashallah.
Thank you very much, sir.
It really explained everything to me. I have a question. I want your opinion on that.
Right.
We are in analytical rubrics, and
Right.
we have criteria which have got a, each one of them has got a different weightage. Let's say the first criterion is half of the value of the second one, and the third one is twice its value.
Right.
I want your take on, can we sort of the numbers that we are given, the scores that we are giving to the weightage of each criterion? Can we do that? Number one.
Right.
So want to know, since you also mentioned, and there is probably a consensus on that, we cannot possibly have a rubric which takes care of everything that the student does, and some student might actually perform too much very well.
Right.
Yes,
Right.
can we have an additional global rating at the end of the rubric, which will of course be subjective, but then it will add to the value of the whole thing, I thought.
Right. Actually, sir, we do have global rating. If you look at the slide, which was the OSCE, I gave the marking scheme for OSCE, and at the bottom you will see there is a global rating.
Right.
And we use that global rating for our standardization. The standardization of the marks and the students.
Yes.
So it is useful to have that to, let's say, get some standard marking on that. Now, coming to the weightage, of course, you see, for example, if 1 point is about the recall of knowledge and other is about application of knowledge, we cannot give equal marks for that. So I think based on the clinical importance and application of that information, the marks should be divided. So the weightage, I think, is important, because we need to value the let's say diagnostic skills, treatment skills, and as compared to simply recall of knowledge.
Yes. Thank you so very much.
Thank you. Dr. Fahad Azam, please.
Ji, sir. Assalamu alaikum.
Walaikum assalam.
Sir, my question is that what I have understood from your presentation is that rubrics might not be suitable and appropriate for all tasks. So what I understood was that rubrics are maybe better suited for tasks that have clear and measurable criteria and may not be effective for more open-ended or creative tasks. So, sir, would it be correct to say that rubrics might not be suitable for open-ended or creative tasks? And sir, another question is, somehow can we use we take the help of technology to create meaningful and useful rubrics?
Right. Okay. Now let's talk about rubric for an assignment, for example. Right. So we have a rubric for assignment, and students have been given the assignment and the rubric, and they know that they have to follow. And we want to give importance to the creativity.
Yes, sir.
Yeah. So we can have a component on that. But as you said rightly, we cannot be the 100% accurate on that, but we can have, let's say, some marks for the creativity of the students, and we leave it as creativity. And then this means that there would be a bit of subjectivity on the part of the examiner, that how they take that or how they define the creativity about that assignment. In this case, if it's possible to the examiners meet and discuss about it. But the one downside of these rubrics, as I mentioned in my presentation, is as well that it might affect the creativity of the students if they feel too much limited by these criteria. So I think we if we are careful, we can give some scope and some marks for creative thinking and creative actions.
Yes.
Although it may be a bit of subjectivity there.
Thank you, sir.
Right.
And so the second question was about the possible use of technology for creating rubrics.
Yes, of course. I mean, if it's something is available with the technology, why not? Why not? I think the things are moving so fast that we cannot run away from technology. The better thing is take advantage of the technology.
Thank you so much, sir. Thank you.
Any other questions, please?
Sir, can I please?
Sure, please.
Dr. Fahad, I need to ask him what exactly does he have in his mind, because technology is something that I am fond of and use. If I can ask Dr. Fahad to please explain that, if we are not encroaching upon your time, please.
No problem.
Actually, I'm myself not clear, but I was just thinking. So for example, in Google assignments, when we create an assignment, it automatically gives us some kind of grids. So I just wanted to ask Dr. Alam Shiri Malik if he is familiar with some kind of apps or websites that can help us, assist us in making meaningful rubrics.
Dr. Fahad, it would be interesting to use nowadays this AI, artificial intelligence, and put up this question that rubrics or marking scheme for this kind of task, and see what kind of answer you get.
Yes, sir.
And you might be able to get some new idea in that. But what I would say is that we wouldn't leave everything to the technology. It has to be combined technology with your input.
Absolutely.
Right. Any other questions, please? If none, thank you very much, everybody, for your support and attention. I just need to share we normally request for from the participants to take part in the charity, and if everyone can donate $1 or equivalent amount to any deserving person in your neighborhood or in any welfare organization in your locality, that would be very helpful, very useful. Second, something we are going to introduce soon is that apart from these webinars, we will be introducing some hands-on sessions, the workshops, and we will make this announcement very soon, inshallah. Thank you very much for your support, and may all you be blessed.
Thank you, sir.
Thank you.
Thank you so much.
Thank you, sir.
All the
Thank you,
best.
sir. Thank you, sir. Great.
Thank you, sir. Thank you.
Thank you, sir.
Yes, sir. Thank you.
Thank you, sir.
And
Allah Hafiz.
Allah Hafiz, sir.
Allah Hafiz and bye-bye to us.
Allah Hafiz.
Allah Hafiz.